Hi guys, welcome to my YouTube channel. If you're new here, my name is Favy with like the double E. I am a medical student in China. I make videos about what it's like to be out here, and sometimes we do lifestyle, fashion, a bit of beauty. But today we are doing something very different. Okay, today is the 26th of January, and I realized January is the month of cervical cancer awareness. Today we'll be making a video about cervical cancer, what it is, who gets it, how it's transmitted, how to prevent it, how to treat it, all the good stuff. So guys, stick around. Let's get into the video. What is cervical cancer? Cervical cancer is a cancer of the cervix. If I said this to a layman, they would actually not understand what I'm talking about. So let's explain the keywords in this sentence, which is the cervix and cancer. So cervix is the lower end of the uterus. It's like that part where the sperm swims up to like go fertilize the egg and make the zygote, and it's also the part where the baby passed through during the labor and childbirth. So the cervix is the narrow end of the uterus that connects the uterus and the vagina. Okay, I'm going to put a picture of what it looks like somewhere on the screen. Now, cancer, when we say cancer, it's like a disease state of the body where the cells of the body grow out of proportion, like they just grow without any mechanism to stop them. Normally, the human body has this mechanism set out to kind of control cell growth, but in a cancerous state, that is not working. Like the body is just producing cells in a particular part of the body out of proportion. Cancerous cells or cancer are actually named by the part of the body it's found. So the cervical cancer is named cervical cancer because of the cancer of the cervix. Okay, good. Let's go on. Anybody with a uterus or cervix is at risk of developing this cancer. So yes, women are at risk of developing this cancer. Cervical cancer is one of the few cancers with like a very known cause. The cancer is caused by a virus, a sexually transmitted virus. It's called human papilloma virus, HPV virus. The human papilloma virus are of different types, causing different diseases. Example of one is genital warts, caused by types 6 and 11. Genital warts are just flesh-like bumps on the skin that looks like cauliflowers that is actually sexually transmitted as well. The human papillomavirus that causes cancers are types 16, 18, 31, and 33. We already established that it is sexually transmitted, but this is where the men come in because the virus infects both men and women. But because the men have no cervix, so it cannot progress into cervical cancer in the long run. But yes, both sexes are carriers and vectors of this virus. At least half of the sexually active people at some point in their life would be infected with human papillomavirus, or you could just say HPV. This virus has a very long period before developing or progressing into cancer. It has a long latent period of about 15 to 20 years. Most women get infected with this virus as long as they are sexually active, and 50% of the time their body's immune system fights off the infection, so it doesn't progress into cervical cancer. But in some cases it does persist and develops changes in the cervix. Now, this is where I'd encourage healthy living. As a lady, you have to eat more healthy, exercise more, stop drinking and smoking if you can. This is us investing in our old age, because we're immunocompromised in some way. This virus can persist and actually cause cervical cancer in the long run. Yes, cervical cancer does not affect younger women. The changes before turning into cancer takes quite a long time, about 15 to 20 years. Most ladies get infected with the virus with no symptom and actually fight off the virus. There's a cancer seen in the older women. That brings me to CIN. Cervical intraepithelial neoplasia. It is like a pre-cancerous stage of cervical cancer. This is where the cellular changes begin. It is developing to become a cancer, but it's not a cancer yet. We have 3 stages. We have CIN1, CIN2, and CIN3. After CIN3 is when we could call it a cancer, but Most people, when they get to CIN1, they could actually regress. This is where the body's immune system kind of fights off the infection and it regresses and it doesn't develop into a cancer. What are the symptoms of cervical cancer? Abnormal vaginal bleeding. Abnormal vaginal bleeding may include postcoital bleeding, which is bleeding after sexual intercourse, or intermenstrual bleeding. That is vaginal bleeding at any other time of your menstrual cycle other than the normal menstruation. We also have postmenopausal bleeding. Postmenopausal bleeding is bleeding after you have clocked menopause. So if you know anybody, or your mom, your aunt is experiencing these symptoms, please visit a doctor. Other symptoms include abnormal smelling vaginal discharge. So if your vaginal discharge has a foul smell, it's not normal. Visit a doctor. Weight loss is actually seen in situations where the cancer has progressed. So weight loss is actually another symptom if the cancer has really progressed. How does one prevent cervical cancer? There is a vaccine set out, the HPV vaccine, that is administered to children from the ages 0 to about 14 or 15 years old. So if you're above 15, it is believed that you have somehow been exposed to sexual activities in one way or the other. This is an assumption until otherwise proven false. If one has been exposed sexually, there is no need to get the vaccine because after infection, the vaccine doesn't really work. So above 15 years of age, there is no way to prevent you getting infected with HPV. As we established earlier, more than 50% of people that are sexually active have been infected with the virus at some point in their life. But there is a way to prevent getting the cancer. That is doing regular pap smears. What is a pap smear? A pap smear is a medical procedure where the doctor takes a swab of the cervical epithelium, or you could actually say the doctor takes a swab of the cells of the cervix and carries out a series of tests, views it under the microscope to see if there are any changes in the cervix. This takes us back to CIN. The doctor looks out for cervical intraepithelial neoplasia, that is CIN we spoke about earlier. And if there is any present, he stages it to know what stage is at. Is it at 1, 2, or 3? And then he knows the preventive measures to carry out to stop it from developing or progressing into cancer. Every woman above 25 years of age needs to carry out pap smears regularly. I feel like it's better to be in the know than in the dark. So please carry out your pap smears. Visit your gynecologist regularly just to know what's going on down there. I did a research about the epidemiology of the disease, and it was said that over 3,000 cases are found yearly in the UK. That's about 9 cases every day. And out of these total cases, 9% were found in women over 75 years of age. Yes, it's a cancer of the older women, but we can actually prevent this cancer in the long run. As we established, one can actually have the virus with 0 symptoms, but the body fights off the infection and it takes a very long time before it progresses into cancer. We might not actually know we have this virus in us until we visit the doctors regularly. So if you're above 25 years of age, please carry out regular pap smears and make your doctor your friend. Visit your doctors regularly. I really hope this video was helpful. I had 0 idea of what cervical cancer was until I studied it in school, and I know someone out there has actually not heard of it as well. So please, let's do well to create awareness about cervical cancer this month and every other month in the year. Let's take preventive measures. Anyways, I hope you guys enjoyed today's video. I hope you learned a thing or two. Please don't forget to share, comment, and like this video and subscribe to the channel. Until next time, bye.